Dr. David Bull's Sunday Surgery.
So there's been an awful lot in the press recently about sepsis, and we thought it would be a really good idea to talk about it. This comes off the back of Tory MP Craig McKinley revealing life-threatening sepsis coma ordeal. He went on to say he'd received messages of support from Rishi Sunak and cabinet ministers. He was put into coma after developing sepsis. He was placed into an induced coma with multiple organ failures after being taken to hospital at the end of September. He's now on the road to recovery, but he's been sent good wishes. He says on Twitter, "I was rushed into hospital with the potential for sepsis. It was indeed correct. I was placed into an induced coma with multiple organ failures." And that then brings us nicely to say, what is it and who can get it? Well, joining us now, I'm delighted to say, is Taz Hoesli, who has suffered from sepsis in the past. We're also joined by Ron Daniels, ICU doctor and founder and CEO of the UK Sepsis Trust. Can we start with you, Taz, if we may? Good morning to you.
Good morning.
Taz and Ron, thank you so much for joining us this morning. Taz, you know only too well what sepsis is like. You're a professional dancer by trade. Tell us your story.
Okay, I'll keep it brief. But in October 2022, I was fit as can be. I was auditioning for West End shows. I was always in the gym, and all of a sudden I came down with sepsis, which was caused by invasive strep A, which turned into septic arthritis.
But let's just go back a bit, because you didn't know any of that, did you, at the time? So you were, as far as I understand, you're going for an audition and then just didn't feel right, and you had sweats, cold sweats, and you just felt dreadful.
Yeah, so I was in this audition, and when I got home, I thought I just pulled my hip flexor, nothing out of the ordinary for a dancer. I was feeling very unwell, dizzy, lightheaded, had sweats, and from the first day of feeling unwell until I was admitted into ICU was about a week. And I think all of us know too well that we try and push through when we're feeling slightly unwell, but this was just different.
So just reading your story as I did yesterday, you kind of tried to soldier on. You then woke up in the night with just, or 4 o'clock in the morning with unbelievable pain, didn't you?
Yeah, so I woke up and it is the most excruciating pain I've ever felt, kind of radiating through my whole body. And my parents, who were in the room opposite, I had to actually ring them because I couldn't even get out of bed, and say, "I'm in so much pain, I can't sleep, I can't even function." And that's when we called 111.
And then what were you told to do then?
When we called 111, this is the first time, the doctor said that there was a lot of COVID going around and that I'd probably just pulled a muscle in the audition. So he gave me high dose of painkillers and anti-inflammatories and just said, "See how it goes."
And then finally you did go to hospital and you were in a terrible state.
Yeah, so a couple of days later, my dad actually called 111 again, and that 111 doctor, without a doubt, saved my life. She asked the question, said to my dad, "I don't want to scare you, but I think your daughter could have sepsis. I'm going to call you an ambulance and we're going to get her taken into hospital." And then obviously the rest is history.
And so then what happened in hospital?
So I was in hospital, luckily actually only for about 10 days. I was in ICU for a week and then...
So intensive care, yeah.
Yeah, intensive care for a week. Lots of things happened whilst I was in there. I'm not really aware of the first 3 or 4 days, but the team were obviously absolutely incredible. And once they found out that it was invasive strep A, I happened to recover quite quickly, which was lucky.
OK, let's bring Ron in if we can now. Ron, thank you very much indeed for your time. So Taz has outlined her story there. Just talk us through. So she felt terrible. She didn't really know what to do. She ended up on ITU. She ended up being ventilated. I think she had antibiotics. Could you just talk us through sepsis? What is sepsis? How prevalent is it?
So sepsis is the way the body responds to an infection. So it's always triggered by an infection, commonly things like pneumonia, urinary infections, but it can be something as simple as a cut or a bite or a sting. But in sepsis, the body's immune system reacts abnormally, and that starts to cause damage to the organs, and that's why it becomes life-threatening. And in terms of how many people this affects, around the UK each year, it's estimated that sepsis affects 245,000 people, claiming as many as 48,000 lives. Now, for context, that means it's about as common as heart attacks and claims more lives than, for example, breast cancer and bowel cancer put together.
I'm staggered to hear that, just in terms of the numbers. But just in terms of this, you said it's always triggered by an infection. So why are we missing so many cases if people are seeking medical advice, for example? Is it because it's not being diagnosed, or is it indeed too early before it turns into sepsis?
So there's a few reasons, really. One of the most important is that sepsis can be difficult to spot because it can arise in people of any age, whether or not they've got underlying illness, and it can arise as a consequence of any infection. So there's no one typical symptom or sign that we can see or people will describe to us. And then similarly, there's not a single blood test that can be taken to tell us whether or not it's sepsis. This is what we call a clinical diagnosis. So it's around listening to the patient and their families. It's around examining the patient. It's around sending a full set of blood tests, taking their vital signs, and then building all of that information together. So particularly as we increasingly engage in virtual consultations, it can be really difficult to spot.
And you at the Sepsis Trust have come up with a rather natty way to look for those symptoms. Let's start with the adults, though. It uses the mnemonic sepsis itself, doesn't it?
Yeah, it does. And this wasn't just us. This was in consultation with the then Public Health England, with several of the Royal College's representatives. And it was a long process of coming to this list of symptoms. So yes, they spell the word sepsis. S for slurred speech or confusion. E for extreme pain in the muscles or joints. P for passing no urine, no water in a day. S for severe breathlessness. I for it feels like I'm going to die, and people really do say that. It's one of the most common descriptors. And then the final S for skin that's mottled or discoloured or very pale. Any one of those 6 symptoms in the context of infection, it is go straight to A&E.
And Taz, let's just bring you in here. Had you known about spelling out that word sepsis, does that apply to you, those symptoms?
Yeah, so when I go back to think about it, every single one of those symptoms applied to me, but before becoming unwell, I knew nothing about them. So obviously it's so hard to spot when you're not aware.
And did it feel like you were going to die?
Yeah, most definitely. It's such, when you say something like that, it sounds like you could never, but it really did feel, especially when I got into hospital, that was definitely a really big worry for me.
And Ron, in children, the symptoms are different.
Yes, they are. And that's partly because children present differently, but also because they communicate differently to adults. So we have a different set of 6 symptoms. We couldn't agree that the same 6 for adults would apply to children. So before I go through the symptoms, it is important to note that sepsis in otherwise healthy children is thankfully rare. Of the 48,000 lives lost, in total, it's only 200 or 300 that are lost in children. Now, that's not diminishing how horrific it is for those families, but it is rarer in children. So we shouldn't all panic about this when our child has a sniffle. But if a child has signs or symptoms of an infection and they have one of the following 6 symptoms, again, you need to take them straight to A&E. So if they're breathing very fast, if they have a fit or a convulsion, if they look mottled, bluish or pale, again, that's similar to in adults. If they have that rash that we're all taught to look for that doesn't fade when you press it under a glass, if they're very lethargic or difficult to wake, or if they feel abnormally cold to the touch. Any one of those 6, and again, they're available on our website, it goes straight to A&E. To my mind, the most important one is this behavioural thing. A child who won't show interest in anything, if they keep drifting off to sleep, they won't even show interest in a cartoon or a smartphone or other device, then that's pretty abnormal, and that child probably needs urgent assessment. So if I had to pick one, it'd be that one.
Yeah, it's a really good one. Dr. Rennie, shall I bring you in here? How do you see this?
So obviously we are looking at people who have got infections all day long. So that's the job that we do. Ron, I know Ron well, Ron knows me. I wanted to highlight something to Ron that I'm not sure if he's aware of. So obviously as a GP, much of what we do is on our clinical examination, and much of that is over the phone. But if you ask the right questions, you can decide who to be seen, although we do see lots of people now. Ron, I don't know if you know that before COVID, if I was really worried about someone, but not enough to think they needed to go to A&E. I could get them immediate bloods. I could send them to our local walk-in centre there and then on the spot and have the bloods within a few hours. In COVID, that changed, and all blood appointments had to be made by phone. An appointment, which was usually about a week or 2 weeks later, that has never reverted back to on-the-day bloods, because the local authorities have decided that it's better to have people come by appointment. So I cannot get same-day appointments as a GP anymore for blood tests.
Ron?
Well, I mean, I wasn't fully aware of that, Renee, and thank you. But this problem with accessing diagnostics within the NHS, it's widespread. It's not restricted to your practice. It's in hospitals as well. As laboratories increasingly centralise, so there might be one in a given city, it takes longer and longer to take blood tests. And there isn't really an incentive for laboratories to deliver testing more rapidly or closer to the patient, because it costs the laboratory more money, but they don't receive more money. So we've got to fix this. We've got to improve across the NHS the way we health professionals at the front line, in front of the patient, can get the results we need quickly.
And do you think, Ron, we talk about this year after year, but point of contact CRP testing for GPs, do you think that would help?
So CRP, C-reactive protein, which talks about the amount of inflammation in the body.
Yeah, but pretty much. And there are a number. So we call these things biomarkers, and there are several of them. And C-reactive protein is probably as good as any. And it doesn't really matter which one we choose. A diagnostic tool that can help a GP might help an emergency physician when they're thinking, do I send the patient home or do I admit the patient to hospital, to decide whether there's likely to be an infection or not. Now, what these tests don't really tell us is how severe an infection is if it's there. Just help us to decide whether it's an infection, whether it might be bacterial and need antibiotics or not. If we can get those integrated at the point of care, in the GP surgery, in the emergency department, that would significantly help. Not only would it help to spot people like Taz who are genuinely developing sepsis, but it would reinforce our decisions not to give antibiotics to people who probably don't need them.
And this is the crux, isn't it, Ron? Because as GPs, we're under pressure now to not prescribe antibiotics because most things don't need them. But it is a fence
because of antibiotic resistance.
Yeah, and it is a fence that we are sitting on, trying to decide by our gut and nothing else what this patient needs or where they might go in the next 12 hours.
Sorry, Ron.
Absolutely. Go on. I was just going to say, I think we've come some way in educating the public around what they might need antibiotics for and what they might not need antibiotics for. But I think we do have to do a lot more. This sort of culture of, I'm going on holiday in a couple of weeks' time and I've got a sniffle and I just don't want to have a cold when I go on holiday. That sort of inappropriate antibiotic-seeking behaviour, I think we have reduced. But again, we need further public information around this to reduce that pressure on GPs.
Let's go back to you, Taz, if I may. So thankfully you were sorted out, you went into ITU, you got given antibiotics. The recovery hasn't been that straightforward though, has it?
No, because of the septic arthritis and as a professional dancer, the recovery process has been much longer than I expected, and it's been a really tough journey, but obviously very grateful to be here, of course.
Of course, and how are you doing now?
Yeah, I'm doing so much better. I'm getting back to dancing slowly. I'm teaching, which is great and has brought me so much hope. And I'm hoping at the beginning of next year to start auditioning again, which is super exciting.
Super exciting indeed. And final word to you, Ron. Where can people get more advice? I think you've highlighted those symptoms beautifully, spelling out the word sepsis in adults. Where can people find more information?
So they can go to our website at sepsistrust.org. And it is important that if you're someone like Taz or someone who cares for someone like Taz who's struggling to get over this, or indeed if you've been bereaved by it, we have support nurses available who are trained to help you. So there's a lot of resources there at sepsistrust.org.
Well, thank you to both of you. It's been really, really good. That's Ron Daniels, ICU doctor and founder of the CEO of the UK Sepsis Trust, and also Taz Hoesli, who suffered, as we heard, from sepsis herself. And that was today's Sunday Surgery.
Dr. David Bull's Sunday Surgery.